Hi, welcome to Pharmative Live. I'm Dr. James Partyka, your host, and this is Pharmative Live, coming to you live from Palm Springs, California. This is going to be the shorter 5-minute version of Pharmative Live, and today we're going to be talking about the prevalence of long-term complications following COVID-19 disease. Before we begin, I'd like to thank our sponsors from our sister company, Pride Nation Radio, which is the #1 LGBTQ dance music station in the nation. And all you have to do to get Pride Nation Radio is type in pnn.fm into your web browser or download our PNN One Plus Health mobile app, and you'll get great fast beat music, which is uplifting, and it's great music not only to dance to, but to work out to as well. So let's begin. Today is Sunday, December 19th, 2021, and I have some unfortunate, startling statistics to review with you. As of today, over 50.7 million people in the United States have been diagnosed with COVID-19 disease, and unfortunately, over 805,000 people have died in the United States due to COVID-19 disease. The most important thing that we can all do is prevent the exposure of COVID-19 disease. And we do that by what we've all been talking about for the last almost 2 years now, is by wearing our masks, social distancing, avoid large indoor gatherings, hand washing. That's our primary physical barrier of defense from COVID-19 disease. When you wear a mask, the best masks to get are the KN95 or the N95 masks, which are actually very comfortable to wear and will give you the best protection from getting COVID-19 disease, because it's largely spread through our respiratory droplets. So again, we want to wear our masks indoors. We want to practice social distancing. We want to avoid large gatherings indoors, right? And we want to regularly hand wash and use hand sanitizers. That's our first primary physical barrier of defense from COVID-19 disease. The second thing is to get vaccinated. So for those of you who have not gotten vaccinated, get vaccinated. And for those who are eligible for a booster, get your booster. Bottom line is the booster, that third shot, if you've got Moderna and Pfizer to begin with, and the second shot for the J&J vaccine, that booster gives you full protection against getting severe COVID-19 disease, against being hospitalized, and against being dying from COVID-19 disease. It is not 100% effective. So whether you've had COVID-19 disease before, whether you are fully vaccinated, you still can get COVID-19 disease. Right now in the United States, Delta is the most prevalent mutation of COVID-19, but also we have now Omicron, which is highly contagious and rapidly spreading throughout the United States. Okay. Vaccines are not 100% effective. You can still get the disease, okay, and you can still transmit the disease, okay? It's important for you to understand. So in order to be considered fully vaccinated, you must have received your booster. Again, 3 shots for Moderna and Pfizer, 2 shots for J&J. The second shot of the J&J vaccine should be either the Moderna or the Pfizer. Again, to give you full immunity, to arm your immune system against COVID-19. All right, let's begin. Recently, there was published in the Journal of Nature, which is a highly reputable peer-reviewed journal. The first author was Sandra Lopez Leon, and other investigators did a systematic review of published literature in order to estimate the prevalence of long-term complications of COVID-19 disease. That full access article is available on our online health magazine, PNN One Plus Health magazine, located at pridenation.com. That's pridenation.com. Again, it's the feature article of this week. which is the full article for your reading and review of the data. It's a well-conducted publication review with a meta-analysis, and the statistical methodology is sound, sophisticated, and it gives us an idea of a snapshot of new and old cases of long-term complications. Before I begin to review that data with you, I just want to ask you, do you know of anyone who has had COVID-19 disease? I do. Do you know of anyone that's died of COVID-19 disease? I do. Do you have a family member or a friend member that's recovered from acute COVID-19 disease but still have lingering symptoms? And I do. We have a close friend that had the disease prior to the vaccines being available in the United States, and still suffers from confusion, which is oftentimes referred to as brain fog, as well as fatigue. Okay, so the long-term complications are becoming more well-known, better characterized, but there are still unknown risks of the disease as we study the disease both in the prevention, the treatment, the acute phase of the disease, and understanding better the long-term complications of COVID-19 disease, which are known and unknown risks. So the bottom line here is you do not want to get COVID-19 disease, and you want to do everything you can to prevent from you, your family, your friends from getting COVID-19 disease, and also from preventing the spread of COVID-19 into your community. So bottom line, if you suspect you have the disease, you're having some difficulty in breathing, you're having a fever, some chills, get tested. If your test results are positive, immediately self-quarantine. In fact, self-quarantine before you get your test results back. And then call your doctor's office so they can help you monitor for symptoms of the disease. There are treatments available. We've talked about monoclonal antibodies. And under FDA review right now for national emergency use are 2 oral antiviral medications, one by Pfizer, one by Merck, that are under review now that hopefully will be available soon for those people that do develop COVID-19 disease. So let's begin. Let's review the data by Sandra Lopez-Leon and other investigators that was published recently in Nature and is available on our online magazine at pridenation.com. They basically reviewed over 18,000 published studies, okay? And then they developed criteria to look at people that are 17 years of age or older, and they were as old as 87 years of age in this study. And they did a systematic review and looked at the published studies with 100 patients or more, and that brought them down to 15 studies of patients, adult patients between the ages of 17 to 87 years of age with mild to moderate to severe COVID-19 disease, looking to see about the prevalence of long-term complications. The 5 most common long-term complications associated with acute COVID-19 disease include fatigue, 58%, headache, 44%, attention disorder, 27%, hair loss, 25%, dyspnea, 24%. There were other complications observed as well. Sleep disturbances, insomnia, abnormal chest x-ray or CT scan, cognitive disorders, joint pain, persistent cough and chest discomfort, and even diseases such as stroke, diabetes, dementia, acute respiratory syndrome, and patients left with a hypercoagulable state. So think of this not only as a respiratory illness, but also as a systemic illness, okay? And the authors described other complications which are listed for you in that article on our online magazine, pridenation.com. And they concluded that it's important that we develop multidisciplinary teams to develop preventative measures to develop rehabilitation techniques and then clinical management strategies, developing new clinical management strategies to help people suffering from long-term complications of COVID-19 disease. Now remember, there are known risks, and these are the ones that I just listed for you, and there may be even unknown risks also. So the bottom line is we want to do everything we can to prevent the spread of COVID-19 disease, prevent you and your loved ones from getting COVID-19 disease. And we do that through wearing our masks, social distancing, hand washing, using hand sanitizer, and avoid large indoor events. And if you're attending a large indoor event, get tested, get a rapid antigen test to make sure you don't have the disease when you're entering into a large indoor event. And then, of course, you want to get fully vaccinated, which includes a booster, all right? And we still want to keep practicing using our masks and social distancing and hand washing in order to prevent getting the disease acutely and preventing getting the disease from the long-term complications of COVID-19 disease. Well, that's all I have for today. In the meantime, until we meet again, stay healthy, as it's easier to prevent disease than to treat disease.